Now, Leanne's taken pity on me and my terrible infographic and has greatly improved it. So here we have the coronavirus in the middle here, and how we are going to attack it. Well, the stay home lockdown is attacking it from the top. The antigen test for the virus, test, track, trace, treat, attacking it from the bottom. Then we've got, we're hoping for therapeutics, we haven't got them yet. We're hoping for much more antibody testing that's going to help attack as well. Vaccination will be the ultimate liberation from this virus. But in the meantime, we've got personal hygiene, washing your hands, face coverings. All these things are attacking it, especially if you are potentially infected. Then infected people should wear face masks, whether they know they're infected or not, of course. Herd immunity will develop as more people develop immunity from having the infection and ultimately, of course, from the vaccination, which will feed through into herd immunity. And physical distancing is going to be with us for some time now. So thank you, Leanne. That was much better than my infographic. I'm sure many more people understand now. So that was great. Now, welcome. Thank you for coming back, as always. Monday, the 27th of April. Now, let's start off with a few international things, and then we'll focus down a bit on a couple of extra topics as well. So, to begin with, we notice the total number of confirmed cases now is essentially 3 million, and this will carry on rising. And it is already way higher than this, we know. Over 200,000 official confirmed deaths at the moment. Now, Jennifer in Australia has come up with some rather good expressions. You know, it really is bemusing why it's not compulsory to wear masks in all public places. Because if anyone has the infection, then they will be breathing out the virus. Notice I use the word breathing, not coughing or sneezing. They'll cough and sneeze it as well, but they'll also breathe it. And of course, many people don't know they're infected because of pre-symptomatic and asymptomatic spreading. So all public transport, all places like supermarkets, any indoor place, people should be wearing masks. And it has to be universal because of these people that don't know they have it. I may have it and be spreading it to you, I don't know. Because I may be pre-symptomatic or asymptomatic. So I like these two. Putting on a mask is an easy task. One thing I ask, put on a mask. This is very straightforward. Now, what you can do, go onto YouTube, and I'm not going to teach you how to make masks. Go onto YouTube and you'll find lots of videos on how to make masks. So run a few up and start being a trendsetter in your area. And if you want, you can say John said so. So that's fine. They're not going to protect you that much from infected people, but if you are potentially infected, they're going to infect those around you. And very often in infectious disease situations, we have to think about how we're protecting those around us rather than how we are protecting ourselves. We need both of those going on at the same time. Now, Canada is interesting in that things in Canada are actually going quite well. So 47,000 new cases. There is quite a lot of deaths. And pleased to see that Canada is one of the countries working on a vaccine. Now, there are about 72, I think, officially registered vaccination programs around the world, which is brilliant because they are not all going to work. It may be that some turn out to be unefficacious, that they don't generate the antibodies. It may be that some turn out not to be safe. It may turn out that some cause unacceptable side effects. So they're not all going to make it. So the more groups that are working on it, then the better that is, really. So let's just have a look at this graphic now with Canada on. Now, what we see here now, first of all, when you're looking at these graphs, this is from World Data. Now, I do recommend you go on here, but the trouble is you can get stuck on for hours, as I said before. It's so interesting. But you can basically generate your own graphs. So this is a logarithmic scale. So that's 0 to 10, 10 to 100, 100 to 1,000, and 1,000 to 10,000. So do bear in mind that this is a logarithmic graph. These are not linear. So New Zealand has got, as we'll be seeing, very, very few total confirmed deaths. This is confirmed deaths and how rapidly they are increasing. So New Zealand, I think, has got about 16 deaths, so that's good. Now Canada, remember this is a logarithmic scale, so Canada, as we said, is up to 2,666 deaths on my last check with Johns Hopkins. Whereas the United States and the UK are 10 times more, because remember this is a logarithmic scale. So the United States, we see deaths increasing, the United Kingdom deaths increasing. Now, to be fair, the line is flattened out a bit, but it's still, the total number of deaths are still increasing. So Canada there is doing reasonably well, better than the UK and better than the United Kingdom. So that is interesting. Now, moving on to the United States itself. So the United States. Right, so it's basically today the United States is going to reach 1 million cases. So that is a grim milestone indeed. Now, what is the real number of cases in the United States? Well, it's higher than this, of course. How much higher than this, we don't know. Could it be 10 times higher than that? Yes, potentially it could be 10 times higher than that. Is it 20, 30, 40, 50 times higher than that? Almost certainly not. So it is higher than that, but how much higher than that, it's hard to say. So we're still, if we're talking about, if it's 10 times that, 10 million people, we're still talking about a relatively small proportion of the United States that are already infected. And this is one of the things that struck me, actually. Our world in data has had doubling days on it. So cases have doubled in the United States in 12 days. Now, to be fair, that is quite slow because many states have taken quite stringent lockdown measures. But we can't get away from the fact that this is still increasing and that we are still in the early stages of this pandemic. We are still in the early stages, unfortunately. Cases have doubled in the last 12 days in the United States, despite significant lockdown measures. Now, this is good. I'm not knocking it. We want this to be as slow as we can so we can cope, so health services can cope, but it's still increasing. We are still dealing with an increasing pandemic. Deaths in the United States continue to increase, sadly. Nearly 55,000 deaths in the United States now. Now, Georgia. Now, I don't know if I'm being cynical here. I've called this the Georgia experiment. So Georgia is going to be the first state, by the looks of it, to open up significantly. So let's think about that. So Georgia is relaxing a lot of its restrictions. It's good. People can get back to work. People can make money. People can visit relatives. You can go for a walk with your boyfriend or your girlfriend. So that's nice. But the point is, more people are going to become infected and more people are going to die. It's a real trade-off. Having said that, people can die for economic reasons as well. And another thing that's concerning is people haven't been accessing healthcare for other conditions other than COVID-19. So that can cause more deaths as well. So basically, what's going to happen in Georgia is there are going to be more cases of COVID-19, many more as they ease the lockdown. And there's going to be more deaths. But it is going to be maybe a case study for the rest of the United States to watch with great care. Maryland is increasing. Massachusetts is in a bit of a surge, another up to 54,000 cases. Now, in Los Angeles County, it's the leading cause of death now, and people of colour are more affected. Now, I want to make a point on this, and you'll be bored if you listen to these videos regularly. But I was listening to a commentator on US TV network this morning, and he was talking about people of colour being disproportionately affected, more severe disease, more deaths. And I can't remember what he mentioned, but he mentioned socio-economic factors and occupational factors. But no one seems to be talking about the simple scientific fact that the darker the coloured skin, the more slowly the vitamin D is made. So I really would ask people in the States, all over the world, and the darker coloured your skin, the more important this is, to contact your healthcare provider and say, look, should I be taking vitamin D? Because we know from other studies that many people with darker coloured skin in the United States do have lower vitamin D levels. And we do know that vitamin D is important for immunity. As I've said, I'm taking 50 micrograms of vitamin D a day. So it really seems to be a factor that's completely missed. There seems to be some blind spots in this pandemic. There were so many blind spots at the start. There was such denial at the start. There was cover-up right at the start, and then the World Health Organization didn't get its act together in restricting travel, which we're now paying the price for now, of course. But the other blind spots seem to be wearing masks in public, and the possibility that lack of vitamin D is a major global factor. Anyway, that's just my thinking on the matter. There are videos on this. Right, New York, pleased to see that they're recruiting pharmacies to increase testing. So testing being ramped up considerably there to make this invisible enemy visible with testing. Now, Italy has suffered dramatically, of course. Lots of cases, lots of deaths. Lockdown for 7 weeks now, very strict lockdown in Spain and Italy. And I was saying yesterday how I admire the Spanish population for their discipline. The Italian population has been the same. Now, this has been really good to upset my my national stereotypes. We normally think of Germans and British being well disciplined, and we normally think of Spanish and Italians being less well disciplined. Well, it's been exactly the opposite. There's breaches of discipline in my country, and there's a lot of breaches of discipline in Germany, even worse than in my country. So I'm glad to see my stereotypes have been challenged. But seriously, I really want to pay my respects to the people of Spain and the people of Italy for the extreme discipline that they have been demonstrating. I'm impressed, and I know people impressed are around the world, and your national reputations have greatly increased. It's impressive. Now, we're looking at very gradual reopening in Italy now because of the reduced death and cases that this discipline has brought about. So parks are reopening soon. Takeaway food next week, which will be nice. So you'll be able to take a pizza. You won't be able to sit in a restaurant, but you'll be able to get a nice Italian pizza. Nothing like Italian pizza. 18th of May, museums are reopening. Schools remaining closed till September. That's interesting. So they've said this school year is basically written off in terms of face-to-face tuition. Of course, they're doing lots of online tuition. Social distancing remains, of course, and basically that's true for everyone. So wherever you're listening, anywhere in the world now, let me give you a message. Social distancing, I believe, is going to remain until we have widespread vaccination. Social distancing is going to be with us for a year or more. I'm glad to see the Italians are talking about wearing masks in public transport and in public, as we looked at in some detail a couple of days ago. Now, France. Cases have doubled in the last 18 days. So this is slow. So this means France have done remarkably well. Again, with a draconian lockdown, but still 22,000 deaths, 23,000 deaths. And they're starting to ease the lockdown now as well. Again, slowly, cautiously, judiciously. So again, France is responding well to this pandemic to get things under control, and indeed has got things largely under control. So quite impressive, again, the response from France. Now, the UK, cases increasing, but the rate of increase slowing down. Deaths increasing, but the rate of increase slowing down. Cases doubled in the last 15 days, so that's well slowed down. Got to bear in mind, without the lockdown, cases were probably doubling every 3 days. So this is the difference the lockdown's made. This is the degree to which it's flattened the curve. Now, glad to see our Prime Minister back. Glad you're feeling better, sir. You didn't look 100%, but you looked a lot better than you did last time I saw you on a video, that's for sure. The Prime Minister saying now at point of maximum risk. So what he's saying is quite a lot of pressure in my country to start easing the lockdown. But what the Prime Minister is saying, if we ease the lockdown now, we will undo the good we have paid for over the past few weeks. So it looks like the lockdown is going to carry on in the UK, and the argument being this is going to be better in the long run. And I think I have to agree with him, because even though it's difficult now, if we ease the lockdown, cases would increase, and then we might need even more dramatic interventions later on. This is why it's just so cringeworthy that the world missed these early opportunities. If only we'd stop flights in and out of China straight away. Measures which now look trifling, which look simple and nothing. That would have saved all global aviation pretty well closing down or substantially closing down. So many opportunities lost. The early interventions would have been disproportionately effective. I mean, the whole pandemic could have been curtailed without a Chinese cover-up potentially. It could have been restricted to China. But, opportunities. Anyway, we're at where we're at. Now, this is very concerning, and I hope it's going to turn out to be not significant. But I'll put a link from a publication in this, and it's based on an NHS circular which isn't publicly available, but I have seen it. Paediatric inflammatory syndrome. Now, let's be clear first of all about a couple of things. Children are affected much less than adults. They probably catch the infection at the same level, but way, 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 way less children get serious disease, and way, way less children die than old people. So we're not saying there's been a dramatic change here, but in London, where there's a large population, a trend or a subset has been identified. So this is from the NHS paper. There was a growing concern that a COVID-19 related inflammatory syndrome is emerging in children in the UK. So this is inflammation in the body caused by the COVID-19 infection. Or there may be another as yet unidentified infectious pathogen associated with these cases. So what they're saying is there's these in cases of inflammatory disease, and we'll look at how this manifests in a minute. So they're saying it does seem to be related to COVID-19, but it could be another infection. So is there another infection which people become more prone to when they have COVID-19? Another as yet unidentified viral pathogen, for example, that COVID-19 increases vulnerability to. Let's hope not, but they don't seem to be excluding that possibility there. Now, abdominal pain and gastrointestinal symptoms. So gastrointestinal, of course, is anything from your mouth all the way through to your anus. So sore stomach, vomiting, diarrhea, all these things would be gastrointestinal symptoms, as indeed is abdominal pain. So abdominal pain and gastrointestinal symptoms have been a common feature, as has cardiac inflammation. And this is the real concerning thing, if this is affecting the heart. This has been observed in children with confirmed polymerase chain reaction positive for SARS coronavirus 2, which of course is the virus that causes the COVID-19, as well as in children who are PCR negative. So quite what's going on there, I don't know. But what I think what it means is at the moment, what we can say today, until this is clarified, is abdominal pain and gastrointestinal features in children merits a call to your healthcare provider. I think that is fair to say. So have a higher index of suspicion for abdominal pain and GI symptoms in children. And serological evidence of possible preceding SARS coronavirus 2 infection has also been observed. In other words, I assume what they mean there is that some people who have this syndrome have the antibodies. So let's hope that comes to nothing. But for the time being, it would seem to be expedient to have a higher index of suspicion and to take professional healthcare advice if children have gastrointestinal features, and take advice on that. Now, Australia. Let's have a quick look at some graphics from Australia, perhaps. Yep. So this is the Australia's what do you call it? Side of A4 dashboard. today. Cases remain fairly low, deaths remain fairly low. I mean, it's still a terrible amount, but compared to other countries. And these are the current cases in intensive care units. So New South Wales and Queensland, Victoria, on the east of the country, and only 113 people hospitalised in Australia. Again, mostly in New South Wales and Victoria. Queensland, Tasmania, less. Western Australia, 16. So these are the new cases in Australia. So we see that the new cases are relatively low, which is very, very encouraging. And it's nice to have the map. So Western Australia, cases and deaths in brackets. Northern Territories, South Australia. Tassie, Victoria. Victoria's, of course, the population's mostly down here, isn't it, in Australia? So it's not surprising. New South Wales, 3,000 cases, 34 deaths in Queensland. So quite useful dashboard that from Australia, actually. And I do kind of like that. Nice summary of information. Now, so Victoria rolling out a lot more testing. Victoria testing anyone with upper respiratory tract infections now, so that's encouraging. Basically, the enemy is being made visible so we can see, so we can isolate. This is what we need. One new case overnight in Victoria, so that's very encouraging. Now, other places in Australia, Western Australia, for example, is starting to ease some restrictions. But New South Wales is officially maintaining its restrictions, although there does seem to be quite a lot of breach of discipline in New South Wales and other areas in Australia. So I think Australia really needs to make sure they are obeying their authorities and not nip out. If the New South Wales authorities are saying, remain isolated, then really that has to be done. Because the authorities do seem to be making logical decisions, but there does seem to be perhaps more indiscipline in parts of Australian society than there has been in other aspects of other societies. So I would really appeal to the Australia's really getting on top of things. So let's just keep it going for a little longer, and hopefully it will be free, and then we'll see a brilliant example of that in New Zealand. Now, Switzerland. Again, gradual reopening. Switzerland's been quite badly affected. Deaths are fairly low though, so that's encouraging, although there will be more coming. Garden centres reopening. Schools reopening on the 11th of May. Very gradual lifting. Borders remain closed. Social distancing measures. Bars and restaurants remain closed. So very tentative lifting of restrictions in Switzerland, as indeed we're seeing all around Europe, or around in many places in Europe now, but not in the UK. The UK is remaining strict for the time being. France is remaining quite strict as well. Iceland's been a success story. Small population, rich country, so you can kind of Ireland, of course, up in the north of the North Sea. So test, track, isolate. That's what they've been doing. Quarantining arrivals, so able to control the smaller population there more easily, but still looking successful. And again, hopes that Iceland could eradicate the virus altogether. I did have a report on New Zealand somewhere, but I can't find it. Anyway, I'll mention it briefly. New Zealand have done very well. Jacinda Ardern is talking about the eradication of the virus from the island, which would be simply wonderful. Let's hope that is the case. New Zealand, though, have done very good testing. They've been able to essentially close the borders, 14-day quarantine for anyone coming back in the country. And of course, they were behind the curve anyway. So great if the virus could be eliminated from New Zealand, and I think it potentially could, and from Iceland. Now, cases of more concern, Africa. Bit of a mixed picture from Africa this morning, really. So for the continent, deaths and cases increasing, but the testing, of course, is lamentable. Now, 60,000 deaths a year from yellow fever in Africa. How will yellow fever interact with COVID-19? Don't know. But what it does mean from yellow fever, Ebola, they've got quite a bit of expertise at how to deal with outbreaks of infectious diseases. Malaria season, though, starting in a lot of Africa, so that's going to be a problem. So if someone catches COVID-19 when they have malaria, how does that affect the prognosis? How does that affect the outcome? I don't know. Now, HIV, again, if someone has HIV, I would assume they get COVID-19, they're going to have less resistance, depending on how well the HIV was controlled. Now, I saw some encouraging things coming out. Now, HIV in Africa spread on the truck routes. So truckers going around the country, away from home for long periods of time, staying overnight in various places along the truck route, and significant sexual spread of HIV. So they're aware of this now, and quite a few African countries are doing, I think, was it Tanzania? I can't remember. It was one of the African countries is testing all the truck drivers that come in. Could have been Kenya. Anyway, that's good. So cross-border control it would be a place to focus testing in Africa. Now, goods have to travel around. People need to eat. But truck drivers in Africa have caused significant spread of disease before, and the African authorities are aware of that risk now, albeit the spread via completely different modalities of spread. David Miliband, who's in charge of some big agency, I can't remember, he said Africa had the gift of time. It was behind in its cases. It contracted cases later compared to, say, Italy, for example. Less denial, so there's been stringent lockdowns in a lot of African countries straight away. Movement across borders limited to cargo, as we've said. Oh, it was Uganda. Uganda testing all truck drivers arriving in the country. Right, apologies to the authorities in Uganda. Excellent move. My congratulations. This could well limit the spread of COVID-19 in Uganda, and by extension throughout Africa, basically. Now, TB testing is being repurposed in Kenya, and this was very encouraging. The Kenyan medical scientists are working on a breath test. Now, I hadn't thought of this before. It's just brilliant. So you would just breathe in and out of something, and that would tell you whether you've got COVID-19 coming out of your lungs or not. Wonderful. If they can make that work. Let's hope they can. Such a refreshing new idea to testing, that a breath test, because it makes perfect sense, because you're going to be breathing the virus out in your breath. And if we could test for the virus with a simple breath test, wouldn't that just be wonderful? So that's repurposing equipment that was designed to diagnose tuberculosis with a breath test, which was still being worked on. And I did hear someone saying that basically Africa's being left to pull itself up by its own bootstraps, as we would say in English, because a lot of the testing materials has been bought by people with more money. So that is, and we looked at inequalities yesterday, so that is a concern. Now, South Africa, again, interesting and quite a bit of early success, really. Limited number of cases. Cases doubled in the last 11 days, which is slow. So their measures are working. Relatively low number of deaths. We know there's nothing like as much testing as we would like. A month into lockdown, early success. People wear masks mostly. So why doesn't everyone wear masks all around the world, in public areas and in transport? So simple. People staying at home. Now, the president of South Africa said he's expecting the peak in August or September. So what this means is, I think they realise in South Africa they can't stop this, but they can greatly slow it down. But still concerning that basically in South Africa there's going to be increasing cases all the way through to a peak in August or September, when there is going to be a lot of cases. So really things are being slowed down, which is wonderful. but I think the message is it hasn't gone away. Now, tens of thousands of community workers screening millions of people. So this is what I would call boots on the ground. They've got the foot soldiers out, which is great. I've been a foot soldier myself for many years. Tens of thousands of community workers screening millions of people. And again, they've got a lot of fairly well trained up community workers in South Africa because of the HIV problem and other infectious diseases problems. And the ones that are already trained up can train up even more. So good screening, meaning that testing, even though there's limited testing ability, meaning that can be more targeted, which is good because of the skills with HIV tracing. Targeting high-risk areas for special attention. Now finally, China. Final year in high schools are returning. Hubei school's not going back for another 9 days. But basically, Beijing is still quarantined off from the rest of the country. Largely for political reasons, it has to be said. But it's still good for the people that live there. People have to do quarantine when they come to other parts of the country, to Beijing from other parts of the country. And it's kind of compartmentalised. So people are allowed to travel around, but within their own areas. So there's bigger and smaller areas. So there's not free movement of people in Beijing. It's compartmentalised. And to be fair, the strategy does seem to be working. And the Chinese are claiming way less. In fact, I think there's been no deaths there for some time now. New cases dramatically reducing. But it's still being actively suppressed by this lockdown and partial lockdown and compartmentalisation. Now, we started off with a couple of Jennifer's excellent sayings on masks. So just going to, Jennifer from Australia, thank you. Let's just remind ourselves of your masky sayings. What were they? Putting on a mask is an easy task. One thing I ask, put on a mask. The rules must be obeyed to flatten the curve. That's one. Be persistent while keeping distance. Good. When we're waiting to react, the virus will attack. Is that not true of the entire world? Let's just twiddle our thumbs and see what happens. We might react when we need to. We won't be proactive, though, when proactivity was desperately needed. So we were waiting to react and the virus attacked. More investment in antigen testing. Okay, thank you, Jennifer. Now, just a few pictures now, as we've done for the last few days. Everyone has sent these in kindly and given me permission to use them. So that is Wayne in Australia, in Sydney, I believe. Wayne watching on a large screen. A lot of people seem to watch on large screens these days. Apart from Timothy, of course. Now, Timothy is a truck driver in the United States, and he watches on his mobile phone, so you can just see me down there. So, thank you for watching, Timothy, from your from your truck in the United States, delivering essential supplies, I am sure. Truck drivers, supermarket workers, of course, are essential workers. Now this was from Simon in Vietnam. It's a bit of an arty shot, but I think it's in Da Nang in Vietnam. And what he shows is the virus sort of haunting the streets in Da Nang. So I just thought that was quite a poignant picture, really, that this virus is still there and we have to beware of its presence, even though we can't see its ghostly presence. This is Tilly in Malta, watching on a big screen as well. Thank you, Tilly. Great view. And this is Archie, who is owned by Leah. And I'm not sure Archie's that interested, Leah, but I'm glad you're watching anyway. So thank you, Leah, and thank you, Archie.